So there are a lot of misconceptions about what happens to the core during pregnancy. So we're going to do a little breakdown about what's happening to your core. The core is made up of 4 muscle groups that surround the trunk, the abdomen, the back, and the pelvis. In the front, you have the abdominal wall. Underneath the pelvis, we have the pelvic floor muscles. In the back, you have your back muscles, and then the diaphragm that sits under the rib cage that controls our breathing. During pregnancy, there is a hormone called relaxin that is released that leads to ligament and connective tissue laxity. This is to help the pelvis to open and widen. This can result in things like pubic symphysis diastasis or pubic symphysis pain, diastasis rectus abdominis, back pain, pelvic pain, urinary incontinence, pelvic organ prolapse. So because of this hormone relaxin, the muscles of the core need to work harder to protect our back, to stabilize our back so that we can move and function throughout the day. The abdominal wall, as we can see, stretches past its normal point, which can lead to weakness in the abdominal muscles and more difficulty engaging those muscles. So the pelvic floor muscles can likely tighten or tense to protect against the extra weight and to stabilize the joints of the pelvis. The back muscles are put on more stress and strain because you are losing that core support or abdominal support from the abdominal wall. So it puts more stress on the back muscles. And then finally, the diaphragm that controls our breathing, we lose the ability to take a deeper breath as the belly is growing and the baby and uterus are moving higher up into the abdominal cavity. The key points of what happens to the core during pregnancy are that the abdominal wall becomes weaker, the diaphragm becomes weaker, the back muscles work a little bit harder, and the pelvic floor muscles have to work a little bit harder.